Hi, I'm Harry Target, I've got 41st, and this is bog spavin. So bog spavin is a synovial distension of the tibiotarsal joint. It's visible and it's visible swelling. So the tibiotarsal joint is in this area here. So the swelling normally comes up around here. It can be both sides of the joint, and if you were to push it from this side, it'd pop out that side, and like vice versa. So it's classed as an inflammatory condition. It's an acquired condition and is more common in younger horses, so horses around this sort of age, sort of 3-4-year-olds. The tibial tarsal joint capsule is where it's positioned, and it can be on the dorsal, medial or plantar lateral. It can be on the dorsal, medial or plantar lateral side. It's presented as a distension of the tibial tarsal joint, and it's a palpation. The cause is usually direct trauma, so that can be a kick or an accident. So another horse in the field could kick him in his joint, or he could have an accident like fall over, something like that. It can be caused by repetitive trauma, equine activity or equine surface, the conformation of the horse, suboptimal farrier can be a cause, repetitive trauma, rapid growth or weight gain of the horse, and nutrition deficiency can be another cause. For diagnosis, as there's normally no lameness, but obviously it's quite obvious you get a big distension from the joint, so it's like a visual diagnosis. For the vet treatments, they would give NSAIDs relief drugs, so like steroid drugs to relieve the pain. They might drain the joint capsule, but obviously this is for like a show horse might get it drained to go and show, but obviously it would fill up within the next couple of weeks again, so it doesn't really do anything. It's just like more of a like visual aid. They can give it sodium hydroxide injections. That again just basically takes the swelling down, but again it will come back. With the farrier treatment, you'd obviously start with your static and dynamic assessment of the horse. You would then start with like trimming the foot, trying to make sure you got the right HPA in trim to the long axis. With the shoe side of it, you might put graduated heels on it to lift the heels, to try and relieve any pain or pressure in the joint. You might put a heart bar on, so heart bar on the back foot. So if you come to the foot, this horse is obviously barefoot, but if you had a heart bar, it would come around the back here and onto the frog, so it'd shift the weight of the foot onto the frog, so that would put all the pressure coming down from the joint into the frog and relieve the pressure basically on the foot, so it make the horse more comfortable. You could also put sole packing in the foot. Again, this would just make the horse more comfortable. With the owner management, you would like the owner to sort of keep on top of it, don't let the feet go too long, all stuff like that. Make sure it's given any advice from the vet they're doing, and again like little exercise, getting it back into active work, but obviously not doing too much. Think about the surface you're working on, the discipline you're doing, and then the last thing would be like the prognosis, and that's sort of guarded because it will never really get better. Any gait change will stay the same. It obviously won't look lame or anything, but it'll just have the distension on the joint.